Hi friends, welcome to my channel on Cardiac Essentials. We have been talking about cardiac emergencies like heart failure, and we have been talking about aortic wall stenosis and aortic murmur and various other heart conditions, right? Heart transplantations, valve repair to valve replacement, and general hypertension. So one might be wondering, like, how does one come up with the treatment options for this kind of cardiac emergencies or cardiac management. So when you are talking about cardio diseases and the treatment options, treatment and management, we are basically talking about the cardiac medications. They belong to different classes. Their mechanism of action also differs. How do they work to treat the hypertension or heart failure? And then comes the indications for common cardiac procedures such as angioplasty and stenting, which are nowadays, like, it's becoming common with all the high stress levels on the heart, and we recommend if it is like only if it is required, and some lifestyle modification. What are the risk factor management? What is needed to maintain the cardiovascular disease? So, like I said, when you are talking about the cardiac medications, the important ones, the key ones, the cardiac medications are the ACE inhibitors and angiotensin 2 receptor blockers. Those are called like ARBs. Then we use beta blockers, diuretics, and mineralocorticoid receptor antagonists and statins. So there might be many conditions, like it might be the cholesterol, high level of cholesterol. There might be clogging, it depends on the kind of heart disease they have. So managing heart failure, hypertension. Hypertension is everywhere, like I said, there is some or the other kind of stress always there in today's busy world, It's not, I will be surprised if someone says like, doctors do not have hypertension, or it's everywhere, any kind of job, whether it's personal, whether it's professional life, some amount of stress is always present, and so we have like SGLT2 inhibitors, which are very important for heart failure treatment. And one has to really, if one has to go into cardiology, one has to really understand what is the mechanism of action and what are the clinical applications of these medications, So ACE inhibitors, for example, we can take it lisinopril. Basically, it's given for treating the hypertensive patients, and even after heart attack, it's given as a good tablet for preventing the heart attack. So what is the mechanism of action of ACE inhibitors? Basically, it's there for treating for heart failures. It blocks the conversion of angiotensin 1 to angiotensin 2. What happens is, as a result, it leads to vasodilation and reduced blood pressure. So it's basically given to patients after a heart failure to maintain the high blood pressure. So then we are talking about angiotensin 2 receptor blockers, ARBs. So when we talk about ARBs, the first thing that comes into mind is losartan. So what is the mechanism of action here? They block the angiotensin 2 from binding to its receptors, also causing vasodilation, thus reduces the high blood pressure. Then we have beta blockers like metoprolol, which reduce the heart rate and thus reducing the heart's workload by blocking the effects of adrenaline. And then the diuretics, which is also given for kidney disease patients, also diuretics, so that it increases the urine production to remove excess fluid from the body, that reducing the load on the heart. Then the other kind of medications that we use is like mineralocorticoid receptor antagonists, MRAs, spironolactone. You might have heard of it. So you might be wondering, what is the mechanism of action of this? Why should I take MRAs? So these are basically, they block aldosterone. That is a hormone that can contribute to fluid retention and heart damage. So then you have angiotensin receptor neprilysin inhibitor. So like sacubitril, valsartan, these are like a combination drugs that basically blocks the breakdown of beneficial natriuretic peptides, thus enhancing their effects. So they are good. And then you have this SGLT2 inhibitors like dapagliflozin. So initially it's given for diabetic patients, and these have shown significant benefits in heart failure too, by reducing the cardiovascular events and hospitalizations. Then the other medications are used to treat like high cholesterol, hyperlipidemia. The food we eat nowadays, any food you take, the restaurant food or the preserved frozen food, heat and eat. Heat and eat cannot come on a long way. It's always good to prepare some food. It can be a plain dal with some rice or, sauté vegetables. It can be a fruit salad or a vegetable salad, with some amount of olive oil, salt and pepper. I like salads, and I prefer salads for dinner mostly. So it's very good for high cholesterol. And what's the tabs we used is statins like atorvastatin or simvastatin, which help in lowering the cholesterol levels, reducing the risk of plaque buildup in the arteries. Then you have cholesterol absorption inhibitors, ezetimibe. So what this tablet does is it blocks the absorption of cholesterol in the small intestine. So very good, but it has every tablet has side effects, and every tablet has different effect on different individuals. See, when your heart patient is coming in, we have to be very careful about the heart patient, because one is like the cardio has to be sure what is the physiology of the patient, what is the age of the patient, what is the history of the patient, and the current scenario, the test and labs of the current scenario of the patient, like what tablets could be given, what tablets cannot be given. So even for statins, atorvastatin or simvastatin, it is definitely very good for lowering the cholesterol levels, reducing the risk of the build-up plaque in arteries. So also there are other important classes like calcium channel blockers. You might have heard of calcium channel blockers. So these are basically given to relax the blood vessels, and is usually used to treat the high blood pressure and certain kind of arrhythmias. Then you have digitalis, a type of heart medication, which helps the heartbeat more strongly and can also help in controlling the rapid beat of the heart. So these are some of the medications generally used for treating the heart. So like if you talk about some common medications, it depends on, like I said, like heart problem, we cannot commonly say this medication or this medication. It depends on the patient's history and what is the current situation, what kind of heart disease the patient has got at present and how serious it is. Those all, and what was the history, whether the patient has undergone a surgery or is there a pacemaker there in the patient previously, as he had a heart failure, and what is as he got a family history of heart disease. It is not just a patient walks in and I'm prescribing lisinopril. Okay, you have high blood pressure. Okay, yeah, I'm preserving some lisinopril. Or you have a heart attack. Okay, I'm going to. Don't do like that. There has to be thorough evaluations before the doctor has to come to a conclusion. The patients need this medication. How much the patient can take? How much of power of the medicine can the patient take? What is the age of the patient? What tablet is he under as of now? I know there are a lot of factors. What are his allergies or other allergies? Complete history of the patient has to be known. And then sometimes the patient come up with give me some tablets. Those are less expensive. So rather than looking at less expensive, go in with some tablets. Those are good. So you have to. Some patients are more concerned about the insurances. So there are ACE inhibitors. There are anticoagulants. If you are talking about the type of medications, so you have edoxaxone and heparin, warfarin. So these are nothing but blood thinners. Apizaban or dabigatran or edozaban or heparin. These are like warfarin. These are blood thinners. Although they do not actually thin the blood, they decrease the clotting ability of the blood. So they are best used to treat certain blood vessel, heart and lung conditions. And why these medications are given? Blood thinners. They help to prevent the blood clots from forming in the blood vessels, and may prevent the clots from becoming larger and causing more serious problems. So basically they are prescribed to prevent first or reoccurring stroke or heart attack. See, with this I'm going to end up today's video over here. And if you like my videos, do subscribe and stay tuned. Wishing you all a very healthy and long life. God bless and thank you.